Imagine this is your field. This is your livelihood, your hard work, and the sole way you provide for your family and community. Now imagine slowly losing your vision, and this is how you are forced to see every single day. Your vision slowly slipping away, not because your condition is untreatable, but because the closest medical care is nearly impossible to reach. This is the daily reality behind the number on your screen. Out of the 552 million people worldwide suffering from blinding eye disease called pterygium, the vast majority are rural outdoor workers. They are losing their sight simply because they don't live in a city and can't get the necessary care.
Well, what is a pterygium? Pterygium is a fleshy tissue growth that aggressively traverses across the surface of the eye, and it carries no risk for cancer, but it can cause severe complications if left untreated. Pterygia are directly triggered by prolonged unprotected exposure to extreme ultraviolet light, wind, and airborne agricultural dust. Left unmanaged, this tissue permanently warps the shape of the cornea. It creates severe astigmatism, blocks incoming light from entering the pupil, and ultimately leads to visual impairment and functional blindness. Currently, surgery is the only cure, which makes treatment hard for many to reach, and even then, surgery isn't perfect. The recurrence rate after surgical removal is high, nearly 50% within 4 months and 97% within 12 months, without autograft or an amniotic membrane transplant.
But why does UV protection matter? Accounting for 55% of pterygium cases, the highest risk factor for the formation of pterygia is long-term cumulative exposure to both UVA and UVB wavelengths. The ultraviolet radiation damages critical limbal stem cells and triggers localized oxidative stress. This breakdown promotes the growth of new fragile blood vessels on the conjunctiva and cornea. Farmers, construction workers, and outdoor laborers are at a higher risk due to combined sun, wind, and debris exposure. Our goal at Compass for Communities is to bring awareness to this important issue and protect the eyes of everyone around the world. When we compare rural versus urban communities, the data exposes an alarming healthcare divide. According to the Journal of Global Health, people living in rural areas experience a 120% increase in case likelihood just by living outside a city center. This number is also about severe medical isolation. In a modern city, a patient can visit an eye clinic in minutes. For an outdoor laborer in a remote village, treatment may require exhausting commutes and multiple day boat journeys just to reach the nearest specialist. Because of these travel barriers, minor eye irritation can quickly and quietly escalate into permanent blindness. Even the treatment for these patients places enormous stress on the patients, their families, and the governments in these third world countries. Time is also valuable, as the time spent recovering is time lost from working in the fields and providing for their families. We are Compass for Communities, a student-founded and led nonprofit organization that strives to expand access to basic medical screenings and essential healthcare resources for underserved communities and bring awareness to the struggles that third world rural communities face due to limited healthcare access. When we realized that millions of farmers and laborers are actively losing their vision to preventable disease, we were inspired to start our own project and create a platform to raise awareness of this problem, to educate the communities about the damaging effects of ultraviolet radiation on the eyes, and to provide supplies, such as sunglasses, to prevent the development of pterygia.
Over the past few years, we have continued to expand our vision into a project that has made a real difference. We have partnered with the Ana Vilhana's Institute in the Brazilian Amazon rainforest to bring supplies and education to the people of the indigenous riverside communities. A big part of our work has also been reaching out and securing sponsors here in the United States. In partnership with these companies, we have delivered over 500 sunglasses to adults and children in the Amazon. To reach our goals, we have outlined a 3-stage roadmap leading to 2030.
Looking ahead, we hope to expand Compass beyond the Amazon rainforest and bring our program to more rural communities who face the same challenges with UV exposure and limited access to eye care. As we continue growing, we hope to take what we've learned from working in the Amazon and really utilize those experiences to reach other underserved communities, first throughout Latin America and then eventually around the world. By expanding into these high-risk areas, we hope to bring prevention, education, and UV protection to people who may otherwise never have access to these resources. To make this expansion possible, building strong partnerships is essential. We hope to work with organizations like the Lions Club, local schools, healthcare providers, and community organizations that already have trusted relationships with these communities. Through these partnerships, we can distribute sunglasses, hats, and other forms of UV protection while also organizing educational workshops and vision awareness events. Funding will also play a major role in helping Compass become sustainable. We plan to reach out to eyewear companies, local businesses, nonprofit organizations, and community sponsors for donations of sunglasses, hats, educational materials, and financial support. We also hope to organize school fundraisers, community donation drives, and social media campaigns to raise awareness and help cover transportation and supply costs. By combining our sponsorships, our fundraising, and our community partnerships, we can continue expanding our impact while also keeping our program accessible to the communities that need it most. In Stage 3, our focus is on creating long-term impact through education. Locally, we plan to begin in the United States by partnering with elementary schools and preschools starting in both California and in Arizona. Research shows that childhood habits are extremely effective in building the foundation for strong adult routines. So by teaching children the importance of wearing their sunglasses, their hats, and protecting their eyes from harmful UV rays at a young age will play a critical part in building the adolescent foundation of healthy eye care. Rather than just relying on presentations, we also want to create interactive games and hands-on activities that make learning about UV protection fun and memorable. We believe that children learn best when they're actively involved, and they'll be more likely to share what they've learned with their family and their friends. Globally, we want to expand these educational resources by translating them into different languages, starting with Portuguese for the communities in Brazil. This allows us to make UV protection information more accessible, respect cultural differences, and encourage eye health on a much broader scale. We also plan to recruit volunteers from our own schools and local communities, encouraging more students to participate in outreach events, create educational materials, and help organize fundraisers. By recruiting student volunteers, we can expand our outreach while encouraging more young people to get involved in community service overall. Finally, we want to train local teachers, healthcare workers, and community leaders so they can continue educating their communities, amplifying our impact.
While we believe our ideas and vision will create a meaningful impact, we also acknowledge that traveling and shipping supplies to rural communities is difficult and may come with some challenges. Some of these challenges include shipping and logistical problems, transportation costs, reaching the appropriate remote communities, and gaining people's trust as they implement our educational plan. However, we will do our best to mitigate and overcome these challenges by working closely with experienced organizations and local health officials to reach our common goal of protecting the eyes of the most vulnerable.
Hundreds of millions of people across the world continue to have their everyday lives affected by pterygia. By joining the SDG 3 2026 challenge, we hope to raise awareness of this preventable disease and provide the necessary supplies and education to ensure healthy eyes and thereby promote the well-being of all throughout the world. Thank you for listening.